Hello friends, welcome to my heart surgery channel, and today I wish to share my experience of heart surgery in last year of 2021. Last year was exemplary and where I could achieve 100% success in all my heart surgery cases whom I operated last year. It was a phenomenal year in experience wise, and we did all kinds of heart surgeries apart from the standard coronary artery bypass surgery, where we did quadruple vessel bypass or 5 vessel bypass or 6 vessel coronary artery bypass surgery using latest technologies and latest graft techniques, and all of them went off very well with a good successful outcome. Apart from coronary artery bypass surgery, I also performed lots of heart valve surgeries. Especially, in fact, the last year the focus was on the heart valve therapies, with all kinds of new technologies come in our field. We did a lot of aortic valve replacement surgeries in beyond 75 years of age, mitral valve replacement surgeries, double valve replacement surgeries, aortic valve replacement plus coronary artery bypass surgery, double valve replacement with coronary artery bypass surgery, and also with the tricuspid valve repair surgeries. And all these heart valve surgeries, patients went off very well, and they did very well as far as their surgical outcome was concerned. Our emphasis in this year was to use tissue valves. There is the latest generation of tissue valve which is using dry technology and has assured results beyond 20 years of post-operative period. We use a lot of those valves, although mechanical valves are still we are using, and I'm comfortable. In fact, even with my past experience, patients manage their anticoagulation with the mechanical valve very well. So there is no hesitation, there is no hindrance in using mechanical valve if situation arises to use that. Otherwise, tissue valves are also a preferred choice of the valves. Apart from heart valve surgeries and coronary artery bypass surgeries, I did very interesting cases of left atrial myxoma. One of the myxomas had a coronary artery disease, so we had to do bypass surgery also, along with the left atrial myxoma excision. Then we did some left ventricular aneurysm surgeries, poor heart function of less than 20% ejection fraction. Lots of cases came with the poor heart function. Lots of other cases came with the stent reocclusion, stent restenosis. Almost it's now a weekly occurrence that patients come with the multiple stents implanted in 6 months ago or a year ago or 1.5 years, 2 years ago, and they come back with the stent reocclusion and or stent restenosis. So we have to do bypass surgery in those patients, and we take them, and as and when whatever the new best technology is available to us for coronary artery bypass surgery, we perform them. And it is a hesitation, in fact I will say, from patient's point of view, that those who they opt for multiple vessel stenting, which is not a real good thing, because these stents do get blocked off, or either because of the lack of anticoagulation, antiplatelet treatment, or they miss certain kind of antiplatelet medicines. So the stents do get blocked off, especially in diabetic patients. In fact, 80% patients of coronary bypass surgery do have diabetes, and especially when I see these multiple stents getting blocked, I check the history and I find that almost all of them had diabetes, either insulin dependent or heavy dose of oral antidiabetics. So it's a word of caution that those patients, those who have diabetes and multiple vessel blocks, please, I will advise them sincerely that you choose coronary artery bypass surgery over multiple vessel stenting, because long-term results of coronary bypass surgery versus stenting, it is very well shown that bypass surgery is better as compared to multiple vessel stenting. Then we did a lot of cases where acute infarct was within first 7 days, So acute infarct setting, and multiple vessel blocks were there, so we had to perform coronary bypass surgery, and it went off very well without any inotropic support or intra-aortic balloon pump support. Also did a lot of cases those who had corona infection. In fact, within next 2 months or so, we had to perform coronary bypass surgery. Whether they had a heart attack during corona infection, or they had a multiple vessel coronary disease and they suffered corona infection, so that the blockages increased and the heart function deteriorated. So they had to ultimately undergo coronary bypass surgery. It is important aspect of life now that all these corona patients do have heart problem ultimately. Some of them will have heart attacks, or they may get the infection in their heart valves. So they have to be dealt with surgically. And this is another year where we will face such situations, we will see such patients, and we have to be cautious and define our protocols, define our strategies to deal with these patients safely, securely, and give them 100% success. Then I did a lot of reoperations for different variety of reasons of coronary artery disease or clotted heart valves, and then we did some aortic root replacements. All these patients came to us from different parts of the country, from Mumbai, from abroad, and all of them went off well successfully. So it was a very successful year as far as the heart surgeries were concerned in my unit, and this year is going to be a very important year of my life. This is going to be 30th year of my practice of heart surgery in Mumbai. I came to Mumbai in 1992, and this year is 2022. So this is 30th year of my practice in heart surgery. And as far as the surgical expertise is concerned, I have always given my best to my patients, and with the protocol-based treatment, so that no patient has any complication. Even if a complex issue is there, like we get a lot of patients with renal failure or coronary with COPD or strokes, or elderly patients, and or bad ventricles, what you call as a poor heart function of less than 20%. All of them have strict protocol follow-up, preoperative workup, operative strategies, and post-operative care, and all of them have done very well with my strict protocol following. And I wish that this trend will continue, and I can give my best to all the heart patients, those who come to me for heart surgeries. Wish you all very happy New Year 2022, and we hope that if you require any heart surgeries, please do let me know or consult us, so that we can give our best to your treatment required for. Thank you very much.